Welcome to our session on supportive and palliative care. My name is Margaret Fitch. I am a professor at the University of Toronto in Canada at the Faculty of Nursing, and I have been involved in caring for cancer patients for many years, engaged in research related to palliative care and supportive care. Our session today is going to be an opportunity to think about palliative care and supportive care and clarify what those particular concepts are about. I'm very happy to be joined by two colleagues, Dr. Carla Ripamonti and Pam Cole, and they have expertise in both of these areas. Carla, would you like to start us off?
Thank you, Dr. Fitch. My name is Carla Ripamonti. I am specialized in clinical oncology and in medical pharmacology. I am the head of the internistic and geriatric supportive care unit of the Istituto Nazionale dei Tumori di Milano. The supportive care unit is inside the Department of Medical Oncology and Hematology. I am also professor of palliative medicine at the University of Milano.
Thank you. And now, Pam, would you like to introduce yourself?
Thank you so much. I'm Pam Cole, and I am a member of the Susan G. Komen MBC Advisory Council, and I am the founder of Komen's BOLD MBC Collaborative Research Initiative. I was diagnosed with metastatic breast cancer in 2017 after having been diagnosed in 2009 with early stage breast cancer. Since that time, I've been working with my physician and patients across the country through support groups, et cetera, to talk about how we integrate palliative and supportive care.
Thank you very much, Pam. So to begin our conversation, I think it would make sense for us to define the terms. And I'm wondering, Carla, if you could start us off by talking about what supportive care is and what palliative care is, and define those terms.
Palliative care is an approach of care that addresses the persons as a whole and not only their disease. And the goal is to assess, to prevent, and to treat the symptoms related to disease, and also the symptoms related to the oncological treatments, in addition to any related psychological, financial, social, and spiritual problem are be considered and treated. Supportive care is a little bit different because the best definition of supportive care, according to the multinational supportive care in cancer, is the consideration, the prevention, and the treatment of any kind of toxicities related to the oncological treatments.
Thank you very much. That gives us a beginning understanding of the differences between those labels. So in many ways, we're talking about person-centered care or whole person care, making sure that we are not only looking after the physical needs, but looking after the emotional needs, the social needs, the practical needs such as childcare or care of other family members. But let's turn for a moment to you, Pam. I'm sure in your experience you hear the reactions of people in the community to the words palliative care and to supportive care. What's your experience been in terms of people's reaction to those particular concepts?
Well, I think first of all, it's confusion and not knowing the two different definitions. And for a lot of folks, when they hear palliative care, they think of that as end-of-life care. And that's not, as you've talked about, that's not really what we're talking about now, and how important it is to get supportive care and palliative care from the very beginning. And I think there's a real change going on now with the new drugs that are available for us, that many of us are living longer than before. So this supportive care and palliative care is critically important now more than ever, because we're living with symptoms and side effects and the anxiety of our families longer, and so we need that support.
Carla, could I ask you to talk a little bit about what you see as the benefits of palliative care and supportive care from your perspective as a physician?
And so I believe that both supportive care and palliative care are very, very important in the setting, in the field of medicine for patients, for the family, and also for medicine, because I'm sure that we could not, it's not possible for us to continue with such treatments without supportive care and palliative care. Moreover, it's very important from the psychosocial point of view to have the possibility for the patients, for the family, to communicate with their physician, with the psychologist, with the chaplain, and to express the anxiety, the difficulties they have.
Yes, I think it's so important to recognize that a disease like cancer really touches all aspects of a person's life. And I think one of the aspects I've heard from patients is that as it touches those different parts of one's life, one's relationships, and one's visions of goals that you'd like to do with your life, things you'd like to accomplish, it's sometimes a feeling of being alone and not having others around who understand exactly what's happening. Pam, perhaps if you don't mind, could you talk a little bit about the impact that supportive care and palliative care might have on quality of life or well-being of an individual?
Absolutely. It makes such a difference just on a day-to-day basis to know that I have palliative care, I have supportive care available to me. It gives me a little bit of calm, especially when I'm getting scanned every 3 months and have scanxiety that we talk about. It's also really important that we have the opportunity to meet and talk to other patients in the same situations. That's very helpful, but it can also create anxiety when I'm being treated one way and another patient with the same diagnosis of ER-positive metastatic breast cancer is being monitored differently or treated differently, and that can cause lots of anxiety. Well, am I getting the care that I need at my institution? So it's so important for the calm at the beginning to know, and to help us partner with our primary oncologist about when to change treatment because of quality of care, and reassurance that our pain is going to be managed and our side effects are going to be managed. And it's a way to have that conversation with our oncologist in making important decisions about our treatment going forward.
Thank you very much for joining us in this conversation. And thank you to Carla and Pam for sharing their wisdom and their insight. I do hope that you have found this session insightful and that you have gained some ideas about how you can proceed forward in your journey. Thank you.
Thank you.
Thank you.